Good morning, Liberty County and all of its municipalities, to include the very fine city of Hinesville, the county seat. We are here once again to give you our update, our COVID update. And the cliche has been used, what you want first, the good news or the bad news. The good news that is we're here and we're still talking about it, and we have relegated ourselves to present to you on doing a monthly basis. So we're here doing that for you and for our citizens in our communities which we serve. But I would be remiss if I did not say that what you're going to hear following me is not the best news we'd like to share. Of course, we did know the science was telling us early on that after the 4th of July we would see a surge, and it's true. We are seeing a surge. Right up front, I want to ask you all to please be compliant. I'm going to plead with you, those of you who are not vaccinated, to please consider strongly becoming vaccinated. You hear the stats just as we do, that most of the hospitalization cases are folk who have not been vaccinated, and we don't want that to be you or your family member. So please consider that today. Dr. Lawton said this morning that we have lots of vaccine in our community, in our health district. So it's not a shortage of vaccine, it's a shortage of people coming to get, deciding to get the vaccine. So we ask you to please reconsider if you haven't done that already. That's so very important. And of course, we all know that school has started, and we want to protect our school children and our school staff. We want to protect everybody, actually. Those too who are immunocompromised, and certainly those who are of age or who may have chronic conditions, want to protect them too, because what we're being told is that this new variant can be dangerous to those persons who are of senior status and who may have chronic conditions. So keep all that in mind as we talk about our update today. Keep all that in mind as you talk with your friends and your neighbors, and just as you sit one-on-one and contemplate yourself, what's the best thing to do for you and those that are around you. So I do want to be sincere about that. I do want to ask you to don't take it nonchalantly. I'm finding out that some people, even who I knew, they were, well, I was going to do it, and going to do it led to them becoming positive with COVID. So don't be on the going to do it list. Let's be on the do it list. Right now, we're going to have Mayor Allen Brown from the city of Hinesville to come and make his remarks.
Thank you, Donald. Good morning from the city of Hinesville, a proud member of Team Liberty. Now we have another member who's joined us from Walthourville. Since the onset of the COVID pandemic, we at the city of Hinesville have followed the guidance of our local, state, and federal health officials. 4 weeks ago, Liberty County's Community Transmission Index, which is a very important number, had been consistently low with cases below 100. In fact, it got down to 40 or maybe even into the 30s, which was really good. And that's based on 100 cases per 1,000 residents. It held there for a while, but since that time, things have changed in our community. Donald touched on that. We've had a big holiday weekend, and we have some hesitancy apparently to take the shot. Anyway, now our community is facing consistently high numbers. Our most recent numbers that were as low as 40 or maybe even in the 30s are now between 500 and 600, closer to 600. That's too high. Of course, the health officials believe that this can be attributed to the Delta variant, as well as gatherings spurred on by the Independence Day holiday. As a responsive government, we quickly reinstated our face mask requirement in city buildings and facilities once we saw our numbers go above 100, and it went well above 100, as I said earlier. We will continue to require face masks currently in city buildings as long as our COVID numbers continue to be high. We do hope that they will change directions and start coming back down again. Has not happened as of today. In addition to reinstating our face mask requirement, we also reverted to a case-by-case review of assembly permits, which are required for gatherings of 50 or more people in our city limits. If you are an event organizer or even a business that holds events in our community, please Outline the COVID-19 mitigation efforts you plan to incorporate into your event when submitting your permit. Having said that, we will continue to monitor the impact of COVID in our community, and we will adjust accordingly, and we hope that might turn downward, but it doesn't look that way today. I encourage everyone to take personal safety measures against the coronavirus. Please wear your face mask, maintain your distance, and if you will, please get a vaccine if you're entitled to have one, and pretty much everybody is now. The COVID-19 vaccination is the best way to protect yourself, your family, and our community. The more people who get vaccinated, it is better for everyone. To look up vaccination clinics in our area, visit gachd.org, gachd.org. There you can find locations, times, and types of vaccines offered. The vaccine is free and available for Georgia residents over the age of 12. In closing, I'd like to say I wish we had better news at this time, since we don't, I hope by our next meeting we'll have much better news. Thank you very much.
Good morning, Team Liberty. Good morning to the citizens of Walthourville. In the words of Alan Brown, we hope that things will get better, but right now, let us stay focused. Let's continue to wear our masks, wash our hands, and watch our distance. The city of Walthourville, we have reinstated our mask policy in our government building. Please, ma'am, let us do what we're supposed to do. And I want to say thank you to the Team Liberty for the assistance. And we are on the same sheet of music. When the city of Hinesville moving and when the county moving in a direction, the city of Walthourville is moving in that direction also. Thank you so very much. We'll turn it over now to the county administrator, Mr. Joey Brown.
Hey, thank you, Mayor, very much. So touch on a couple of things real quick. After a call with Dr. Lawton Davis this morning, it's a regular call we have, in fact, going back to a bi-weekly call now because of the transmission rate increase. CDC classifies communities in different ways. As of today, we're classified as a community of high transmission by the CDC under some of those guidelines. Yesterday, we had the single highest day of confirmed cases ever in Liberty County. Our 7-day average since or on August 3rd was higher than we had last winter. Mayor touched on this a little bit, the daily transmission index, which was on July 1st, about 30 days ago, at 32, is now at 586. That's about almost 5 times the level where masking mandates previously under a governor's executive order could have been instituted. Our percentage of positive tests on July 30th was as high as it's been. It's at 29.3%. Give you some perspective on that, on July 9th, not even a month ago, it was at 6.9%. Last 7 days by age group, and this is important, and I'm going to come back to this in a second. The last 7 days here in Liberty County alone, positive test, those infected by the virus, 0 to 9 years old, 20, 10 to 19, 27, 20 to 28, 59, and 30 to 39, 46. It's the younger group that I want to come back to in just a second. The vaccination rate for Georgia, fully vaccinated, is 40%. Liberty County continues to fall way below that average at 22%. Hospitalizations yesterday locally, and this is at Liberty Regional Medical Center, reported at 8. A month ago, they were 0. Now, you remember that number doesn't seem high, except that when you consider the number of critical bed options at Liberty is not that many. In fact, they were diverting patients yesterday away from Liberty that either needed a higher level of care or had COVID. They were searching for respirators. The 2 hospital in Savannah, Candler and St. Joe's, 2 main hospitals, were on full diversion. They've been on full diversion for some time. That's not just diversion from COVID cases, that's diversion period. So for high level of care, it's become a situation in Liberty County where we're having to try to find bed locations for higher levels of care. Those have extended out as far as South Carolina in order to find bed space. So you need to be aware of that. The Delta virus, I think we're all aware, is probably what has caused the spike in that. Viruses, according to Dr. Davis, are rated by R values based on the rates of transmission. Just to give you some idea there, and I thought it was pretty interesting, normal flu virus has a transmission rate of about 1 to 3. That is, if you get it, you can be expected on average to transmit that to 2 or 3 more people. The Delta variant has an R value of 1 to 10. So one person could easily affect as many as 10 more people. Vaccinations, we talked about those real quickly. The mayor mentioned the health department site. I'll spit these out for you real quick, and this is going to be taped. In the Hinesville location only, South Coast, Hinesville Pharmacy, CVS, Walmart number 10, and Liberty County Health Department are offering vaccines. Testing is still done by Diversity, Liberty Regional Medical Center's walk-in clinic, and Glenn and Camden County Health Departments. And I do believe St. Joe's Candler Immediate Med from time to time also has some testing stuff there. As far as Liberty County goes, we did put the mask mandate back in effect for all county-owned facilities. Temperature checks are required when you enter the buildings. We reverted one step back on the recreation venues. The indoor recreation venues are now closed for public use, but right now the outdoor facilities are still open. Courts have resumed under some pretty strict protocols as established by the Atlanta Judicial Circuit. And I would tell you internally, we in fact had a new case reported today of a county employee in a constitutional office division that was affected. That makes the either 4th or 5th case for us over the last 7 days of an infected person of one of our employees. So I guess my little soapbox on the vaccinations is this: realizing that children from 12 and above can get the vaccine. So those that are 0 to 11, that is 20 of those that I'm seeing that were in the 0 to 9. I don't know that these were critical care type patients. Folks, those aren't eligible to get the vaccine. I think it disappoints me to know that almost 98% of those folks that are being hospitalized right now locally have not had the vaccine. They're suffering serious illness from that. The facts are just the facts. I think what disappoints me is knowing, and I wish those folks very well, and I think they will recover. It's disappointing to me to know that as short as hospital beds are right now, that folks that are occupying the majority of those beds probably, the science says, would not have been there if they had taken that vaccine. They would not be occupying a bed space that a child 0 through 9 or another critical care patient, non-COVID related, would have. So that's what we're doing. That's what we're doing as a community with a vaccination rate of 22%. That's the emergency jam we're putting ourselves in. You and one of your loved ones gets ill, tries to go to a local hospital somewhere, they're going to be searching. They're going to do a great job giving you emergency care. But if you have to be transported somewhere, it is very, very, very uncertain where that may be right now for a high level of care. If there is an option, I listened to a comparison. I won't relate. Some in the room were in that briefing scenario of, okay, look, you want to tell me it's not FDA approved? You want to tell me that, hey, even if I take the vaccine, I can still get it? So a gentleman says this morning, you know, parachuting is one of those games where 98 to 99% of the time or better that parachute's going to work. I think I'll carry it with me versus taking a chance of not carrying a parachute if I jump out of an airplane. Seems pretty simplistic to me. If you won't do it for you, if you won't take that vaccine for you, do it for somebody else, okay? Do it for somebody else that either you're going to come in contact with if you don't, or that by you taking that vaccine, you can eliminate the need of a critical care bed right now. Please do that. And I'll leave it at that, and thank you so much.
Thank you again, Team Liberty. I'm going to close with this on a personal note. Yesterday I had the opportunity to speak with 2 young men from our community who were not vaccinated. Let's see, one of them is in his late 20s, the other one is maybe mid-30s. And so that's the group that we're talking about. One of them, I spoke with him on the phone, and if I did not know it was him, I would have known it was him just by how badly he sounded on the phone. But he's doing better, but he's doing better very slowly. And I said, as many conversations as we had, we talked about everything. I never thought Team Liberty mentioned to him about the vaccine. But knowing him as I do, I really thought he was responsible enough on his own. But he was not. He was not. And of course, he said, as soon as I'm better, I'm going to get the vaccine. The other was, like I say, he's in his mid-30s. I happened to see his mom yesterday, so that's how he was doing. And she told me how fearful she was of seeing him in the hospital with all the tubes connected. He was in ICU. He made it out, all right, yeah. But she was telling me how she had to stand there, and she said, my baby, watch my baby that sick. You know, she said, I'm a praying woman, but I was scared. Yeah. But he did make it out of there, recovering very slowly. Of course, he now says, too, as soon as I'm better, I'm going to get the vaccine. You know, we need you to be proactive and get the vaccine before you get that sick. Let's not be nonchalant. Let's not think it's we're too busy. Let's not put it on the back burner. Let's go ahead and do that now. You know, you heard all those before me speak about the importance of it. So we don't want that to be you or someone in your family. And my heart goes out again to the school system. I know a family that where a middle school student has been exposed through his mom. You know, so we want our school kids to be safe. So everybody who's about 12 and above, you know, parents, please get your children vaccinated so they can have a safe school system. We're all happy that they're back in the classroom. That's what we wanted. That's what most of the parents wanted. So if we're going to do that, let's be safe. And let's not fight the idea of wearing masks, you know. If the school says wear masks, you know, let's make sure that our children wear masks. Yesterday, the mayor and I were at Bradwell for the day one ceremony, and there were a few kids that walked through the door without masks on. Of course, the school staff readily handed them one, but I thought, doesn't everybody know you have to come in here with a mask on? So there's still some, what's the word? There's still some non-compliance in our community or lack of respect for what COVID does. And now this new variant that's much more stringent that we have to deal with. So let's everybody step up our game, do the best that we can so we all healthy, we can make it through this. I did not think we would have to backtrack mayors on public facilities. I did not see that coming, and here we are. And if the transmission rates gets worse, we may have to backtrack even more than that. And who wants to go there? Who wants to go there? But we're going to do it about, you know, the science is what it is. Listen, I worked in healthcare. Speaking of healthcare workers are tired. They are tired. They were looking forward to a breather, you know, and now they have to gear up again to go back into the mode, almost like being deployed, going to Afghanistan, Iraq. You know, got to gear up again to that to help fight the battles against this new variant. So let's not do that to them and to ourselves. So we you know, you heard from all of us. We've been very passionate about it. Do what we can as a community. 22% Liberty County, I'm embarrassed by that rate. I'm embarrassed by that rate, you know. And we can do much better than that. Of course, Dr. Davis did say he wasn't sure what the fourth student rates were, but exclusive of that, I want Liberty County's rate to be better. So, but we're going to do it if you're compliant and if you follow the rules, CDC, which says to wash our hands, wear our masks, and watch our distance. Thank you so much, and we'll see you next time.